When I first came to the United States, I was 7 months pregnant with my second daughter. So I was looking for a medical service, prenatal service for myself. But so many people were giving me so much information, conflicting information at some point. First of all, one information that I heard that the government does not give insurance or does not give medical care for pregnant undocumented women. And that is not true. HHS has recently, last September, stated that undocumented immigrants can access Medicaid and use it to care for themselves and for their families, including myself, my baby, and my family. So this is not true. Another issue with this that I heard is that HHS gives Medicaid, but it will affect your immigration status, green card status, uh, citizenship status. That is not true either. As long as you use it for short services, like let's say for preventive services, checkup, not a long-term institutionalized services, you can use Medicaid without affecting your immigration status. But if you are admitted or if you are admitted to rehab or long-term institutions using the government insurance, that will affect your green card or your naturalization or citizenship status, immigration status. So that's what we have to watch. But if I have an option, if I can spend money for my prenatal care, for myself, for my baby, I have three options. The first one is what I found out is first care, patient first care clinics. They do give prenatal services, patient first clinics. They will give you full services, but they do not deliver. They do not deliver your baby. So that's what you have to make sure. A second one is Planned Parenthood. Remember, when we hear about Planned Parenthood, even after I came to here, to the United States, I heard mostly Planned Parenthood associated with abortion, but their service is vast, meaning they can give prenatal care. They also give family care for you, your spouse, and your kids as well. So Planned Parenthood are good for undocumented pregnant women, prenatal care. This is what we have to make sure. But remember, you have to read every document that they gave you. So make sure you double check you get service. The third one is midwives. Midwives, even though they're licensed to prescribe medication, even though they're licensed to prescribe epidurals, they will not perform epidurals, meaning they cannot give you, what they call pain relief epidurals, that a needle goes into your spinal cord and medication will be delivered through that needle. But that they cannot do it at home. That another issue is they cannot do C-section at home. They're not licensed for that because they're not surgeons. But other than that, they will give you complete service for you and for your baby before delivery and after delivery. So remember, make sure you use midwives if you have cash to pay for them. Thank you.